Good afternoon and welcome to National Black Child Development Week. Welcome back to those who have been joining us between today and yesterday. My name is Cemeré James. I am NBCDI's Senior Vice President of Policy. I'd like to welcome you to our discussion on the role of social workers during the time of COVID-19. This discussion will be with Doctors Brenda Jones-Harden and Sandra Edmonds Crewe. Before I just got a message that you can't hear me, and so I'm just going to check my audio really quickly. Dr. Jones-Harden may be joining us a little bit later, but at the moment we have Dr. Edmonds Crewe joining us. Dr. Crewe is Dean and Professor of Social Work at Howard University. She has focused on research and public policy and advocacy in the areas of family caregiving, aging, welfare reform, and the history of social welfare. Thank you so much, Dr. Crewe, for joining us. And can you just say a little hello to the audience before we dive into questions?
Yes, good afternoon. I'd like to greet all of the members of the audience and really thank you for taking time out today for this important conversation.
Thank you so much, Dr. Crewe. So I'm going to dive right into questions. Again, I'll be checking the question and answer for your questions as well. But my first question for you, Dr. Crewe, in any industry, but especially when we're discussing services for families like foster care and protective services, the workforce is the backbone. They're at the front lines, they're engaging families. In foster care, they're working to keep families together and to protect children. As COVID-19 has hit our communities the hardest, what challenges has the corona pandemic presented for the child welfare workforce in this time of shelter in place, this time of social distances, this time of close courts? What has been the impact on the workforce?
Thank you so much. Again, I'd like to start by really thanking all of the child welfare workers, even though the spotlight is on you now because of the coronavirus. You've always been central to the well-being of children, particularly Black children in this country. So I think as we begin to think of the coronavirus, what we see is an intensification of that, because you were always there and you're always there. But as we look at the coronavirus, I think we know that central to the work of child welfare workers is a home visit, going to make the visits to homes. And when there's not the opportunity to do that, we have to use other ways of communicating with not only the children, but also with the foster care parents who are really also doing that work. So the virus, the inability to meet with the children in their homes is certainly a major impact upon us as we think about social work in the community. The other thing to think about the pandemic is that often social workers in the child welfare system are African Americans themselves. And as we're thinking about the disproportionality of the virus and its impact on us, so there's a dual impact. There's an impact on the children, there's an impact on the worker, and again, I should say triple impact. There's an impact on the foster care parent. And then there are those parents, birth parents, biological parents, who are not able to connect with their children, because we have to kind of focus on that. Some of the arrangements are temporary. So we're looking for reunification so they are still connected to birth parents. So when we have this, I really call it physical distancing, because I don't like to think about socially, we're not socially distanced. When we're social workers, we are really still connected in some ways. So the other impact that I really have been informed by my colleagues who work more closely in this area is that you're dealing with foster parents who were not anticipating homeschooling. So this is a burden that they carry. I know with my own relatives and young moms who are struggling to do home schooling as they're struggling to do their regular work, it can be chaos in the home. It can be chaos. So the pandemic has really sort of had us focus a little bit more on that, because many of the children have disabilities as well. So when you're dealing with some of the disabilities that children have, and then they have special needs, meaning special attention to their homeschooling. So all of those things sort of make a difference within the home environment, and it creates. We all have angst, without regard to whether you're in the foster care system or not. Living through a pandemic necessarily gives one angst. But what we'll find is within the foster care community, and also with child welfare, there's added angst. There may be food insecurities in terms of, I know with families having to, they were able to rely upon school lunches for their children, and now they're really having to use their resources to really take care of children all day in the home. So those are some of the things that kind of come to mind in thinking about that.
And you brought up a very good point about the importance of the workforce. The fact that the workforce in social work is heavily driven by our community, that Black social workers are present in this workforce, and how important their role is. But you also brought us into my next question, which will be for Dr. Jones-Harden. Thank you so much, Dr. Jones-Harden, for joining us. You led very nicely into this question about foster parents. So we know that children in the foster care system, that were extremely vulnerable before coronavirus. And I wanted to ask about foster parents, because those vulnerable children, their needs are met by foster parents. And as Dr. Crewe was saying, those needs are very deep. And so, Dr. Jones-Harden, I was wondering, with there being so many challenges to recruiting new foster parents before the coronavirus, what are you seeing now in terms of efforts and strategies to recruit parents during the pandemic?
Well, can you hear me?
Yes, ma'am.
Great. Okay, well, thank you for asking that very important question. Yes, we have had challenges recruiting foster parents for many years, partly attributable to some overarching changes in our society. That said, in some ways, the need for foster families has decreased since I've been in the foster care field a long, long time at this point, due to our utilization of relatives to parent these children. And certainly that is consistent with, one of the things that Robert Hill, the famous African-American sociologist, had said about the strengths of Black families, how extended family has often been the ones who have cared for children. And certainly we have seen this happen in the child welfare field with the recent emphasis on relatives. So that said, you're right, the pandemic has strained this system. But I think there are a lot of things we could do. First of all, we need to work harder to find these relatives to care for children. And, I think about my own work as a social worker, as a young child welfare worker, and how I didn't work as hard as I should have to find relatives, for example, of the fathers of the children, who can be a tremendous source of support. Also, professionals with whom the family has had contact are sometimes willing to provide temporary care. One of the most touching stories that I've heard during the pandemic was about a Latina family where the mother, the husband, and the son were all diagnosed with COVID. The mother was nearing her delivery date and had active COVID. I mean, coughing and fever and all this kind of stuff. They took her to the hospital. She delivered the baby. And of course, she and her husband and son had to recover from the disease. They had no other family in this country. So it was actually the teacher of her son in elementary school who became the foster parent of the newborn while the family was quarantined and recovering from COVID. So, I mean, I think just trying to find out who are the supports in that family's network. And I also want to say in many jurisdictions, foster parent and training and certification is occurring virtually. And I think that is a fabulous idea because we still need to expand the roles of eligible foster parents. So I think we can recruit parents. A lot of people are willing to help during a crisis. So I think foster parent recruitment should continue with maybe a special twist around helping children in the middle of this virus. And finally, I think we have to capitalize on what we have. We need to shore up the available foster homes that we have, giving current foster parents, especially all those elderly foster parents that we have, a lot more support. Reaching out to their relatives to see if they would be willing to be respite caregivers, for example, in case those foster parents became ill or just needed a break. Also, maybe those respite caregivers, which many jurisdictions have, would be willing to convert their homes to be longer-term resources for children. And I also think going back through the records of former foster parents, even where children have been adopted, because nowadays, in terms of permanency, we've lost a lot of foster parents because they've become adoptive parents. But going back to even those parents and seeing if in the midst of this crisis, they might be willing to convert their homes temporarily as resources for foster children.
Thank you so much. I mean, Dr. Jones-Harden, that answer just touched on so many points. First of all, The Strengths of Black Families by Dr. Robert Hill is a reading we just actually assigned to our NBCDI policy fellows. And NBCDI is a strengths-based organization. And so we absolutely believe that the foundation of all our work is the strengths of Black families, and that Dr. Robert Hill's work is foundational. That in the history of child welfare, it's really been informal between Black families using kinship care. That really comes from the strength of our community. And so your story about, again, reaching out to educator who took in a little baby as a foster parent, again, shows that really building on the strength of communities and building on the strengths of our families is what is most important right now. I love these very specific strategies that are being used to virtually recruit foster parents. I think I've heard lots of ways that we can help families right now, but one of them that we must lift up is stepping forward to be foster parents. And I've heard multiple of my friends who are stepping up in this way, especially during this time. So that's wonderful to hear. I'm going to pose my next question back to Dr. Crewe. We have right now so many family courts that are shutting down, and it leaves many children and parents kind of in limbo because the parents who are seeking to be reunified with their children, they don't have a way to show that they've improved their parenting, that they're in a position to be reunited. They don't also have a way to fight to get their children back. What do you suggest to social workers to make sure parents and children are connected during the pandemic?
Thank you so much. I think it's the role that social workers have always had, and that is to start where the client is as we think about social work, understanding that that adds to the angst, that I was really prepared for my child to come back home and this has interrupted that. So I think the role of the social worker is to continue to work with the family. And I say family very deliberately because it's a family decision here. I work with the family to make sure they're continuing to do the things that will really indicate that they are ready and able to take their children back and care for those children, to keep the parent, the birth parent and the children connected during this time so that there's no disconnection in the relationship. The relationship continues to be strong. Using all of the virtual technologies that we have to make that connection go forward. Given opportunities for given ideas to parents, birth parents, as to what they may do in terms of thinking about the next steps. It has sort of added an unintended opportunity for them to think about what will it be like when my child returns home, giving thought to those kind of processes so that we're not so focused on what we can't do, thinking about what we can do, and planning for the child, having the conversations with the child, what we can expect once we're able to return to the new reality that we're facing with. So again, it has been said that, social workers were built for times like this, meaning that's that's who we are. We are the ones who step in during crises. And so this is yet another crisis that we're stepping in with. But I think sometimes we underestimate the value of the technology. We sort of look at it as something we've had to add to our toolbox. But we may want to really think about what works best. Looking at some of the evidence-based information that's out there to say, what works with a 4-year-old may not be the best way of talking to a 12-year-old. And I know we know that. But when it comes to using technology, what are the ways that we can make sure we strengthen our skill set? So I think those are the kind of things we need to really work on. Self-care, really important, because if you are so anxious, then you will not be able to move back into the position that you want to move in. So making sure you're checking in with others, telehealth, telemental health, making sure that you're checking in with your own self so that you are ready to help your children as they transition back into your homes. One of the things that I often talk about, and my colleague, Dr. Brenda Jones-Harden, has kind of spoken about this as well, the strengths perspective. But I think we have to make sure we're focused on strengths and not just resilience. Too often, resilience has become the intervention. We want individuals to rely upon their strengths, but we need the system to step in as well, to support them. We know how to make a way out of no way, but we really don't want to do that every time. We need structural changes so that, for example, if that child is aging out of the foster care system, we need changes to make sure that we may extend the time that they have during this period of time. Even in the academy, we're looking at extending the tenure clock. Well, certainly, if those individuals need an extension, those in our foster care system need the same kind of attention as we sort of look at that. So I think we as social workers really need to make sure that those families, the family systems, are working together, and that it's not one person doing this, it's the entire family. And getting that mental health coaching that you need, because you'll need the mental health coaching to kind of get through this.
Yes.
And not being concerned about stigma. We all need a little time on the couch from every now and then. And if there's ever a time, this is a time for us to focus on getting ourselves ready for when the children come back, and not perseverating on the fact that things have been delayed. So when you're ready to go into court, be ready. Be ready with all of the tools that are available for you.
Dr. Crewe, you actually answered the question and then answered what would have been my follow-up question about what we need to do to support our workforce right now, who are also struggling. I know social workers, they're strong. They have, as you said, they inherently are prepared for crisis situations. But I do think that we must have the system step up and continue to support them. I'm going to read a question from one of our participants, Amber Sansbury, for both of you. I have a question about the role of social workers in supporting families or school communities who may have lost a loved one, particularly now we cannot be together due to physical distancing. Dr. Crewe has given me a better way of saying it. But particularly now when we cannot be together, speak to the new ways that families and school communities are grieving and adjusting to the pandemic.
Well, if you want, I can take that on a little bit. I'm actually sitting outside a funeral home right now, about to go in when this is over to a funeral. The first thing I want to say, and I want to really relate this to the little children in the foster care system, as Dr. Crewe has said, the Black community is in, and we're learning this with the data, much more vulnerable to these mortality kinds of outcomes than other groups. So it's more likely, just like Dr. Crewe said, in terms of racial disproportionality in the foster care system, it's also more likely that Black children are going to experience the loss of a relative. And to think about that while they're in foster care is horrendous, because they're losing this person, and hopefully it won't be a birth parent, because that'll be even harder, without having an opportunity to spend their last days with them. So one of the things that I think Dr. Crewe talked about being ready, I think one of the things that social workers can shore up on is how we were trained to help children with grief. It's one of the things that I remember learning as a young social worker. We were reading Kubler-Ross back then, but there's certainly a lot more available now about helping children through grief and loss, sort of giving them mementos of the person, helping them to write a story about the person. Nowadays, you know, I'm learning from my kids about TikTok and all these other kinds of things. You can put memorials of that person. But I do think because Black children are much more likely to experience these kinds of losses, we need to work really, really hard to keep them as connected as we can during this crisis to their relatives, and particularly their birth parents or whoever their primary caregivers were. You are able to say goodbye to a person a lot better if you've had the opportunity to be with them in an emotional way. So as Dr. Crewe said, not just thinking about physical distance, but thinking about social connections, emotional connections, as another colleague of mine said, are really important. And we've learned from military families, how much we can do, as Dr. Crewe said, with technology, having parents to read stories to their children that we can keep forever, having parents to give prayers to their children, audio tapes, having parents to create with children stories about their lives. Those are the kinds of things that can occur through technology that allow children to maintain connections, and then allow them to have something that they can go to if they end up losing that person. And this becomes a particularly tough issue for children in foster care, because the theme for them is loss, grief and loss, right? Because even if a parent doesn't die, if they're not living with a parent, even if that parent, I like to tell my supervisees, even if that parent abused them terribly, those children still have a connection to them. And we owe them to promote their mental health and opportunity to be with their relatives in whatever way we can. And I know social workers, as Dr. Crewe said, are completely overwhelmed with all of this, and we can't expect them to do everything, but little things like maybe getting mementos from the parents that they can have the children keep at the foster home, those go a long way to help children deal with the sadness that comes from grief.
Thank you, colleague. I would add to that, we don't want to minimize anyone's pain. The pain is what you feel. And so we have to find ways to make sure that both the parents and the children are able to express their pain. And sometimes we tend to say, well, you know, we will get through this. But we need to take a moment and stay in the moment with the pain. Because if we're able to do that, we can find out from children how best to help them. So we have to avoid sort of giving adult advice to children. Children need to be in the moment. I work with grandparents raising grandchildren. And again, as my colleague has said, many of those children have experienced trauma already, and they've experienced a loss. So we need to make sure that we are not having them, we're not seeing them as little adults. They are children and they have to grieve in their own way. The same thing we see with adults. There are individuals who are passing not because of the coronavirus. They are passing because of other natural causes. But what we have lost is the traditions, related to really giving tribute to that person who has passed. So it's how we're able to celebrate the life and mourn the loss simultaneously. So those are the skill sets as social workers we can work with the person on. Being able to say it's okay to talk about the person. On Mother's Day, I was speaking with my sister who lost a child, and saying that we can talk about her. You know, we don't have to say, oh, that's going to upset the person. And sometimes we set rules that are not really what the person needs. So we have to start with what the person needs and being able to use our clinical skills to say that, you know, this child is more quiet than usual. But the foster parents or the other parents, biological parents, they are also grieving. So I think we have to think about working with the family and not just with the individuals. So I think we have to, virtual allows us to do that, to have family conferences, that we're meeting with everyone, the other siblings who may be in a different home, who may be in a different location, but keep them connected. And also we can never forget the spiritual part of it. Keep them connected with their spiritual traditions, whether that means calling a pastor and having them speak with the person. Sometimes it takes a different layer, and social workers are the connectors to say, you know what, this may be better handled by a different professional, but we're all on the same team.
So I love these very clear, practical ways to support children in feeling loved, supported, but to also support their mental health. Again, you've already taken away, given the answer to my next question. But so I hear a lot of conversations about practical tools for homeschooling, but what you've both given us here are really practical tools to support the mental health of children who are grieving, of families who are grieving. You've given practical tools, again, such as creating mementos on social media, or supporting children who are disconnected, who have been separated from their families, by ensuring that the family traditions and even family mementos are potentially present for that child. So thank you for those. I think having those practical steps, that's the type of thing that people need from us, and look to us for those types of resources and that type of information. I'm going to go again to the questions that have come in, saying, I recognize and truly appreciate all the work social workers do on a daily basis behind the scenes. We only know a snapshot of the services because they keep so much of what they see confidential. And it said, keep up the great work. Another question that also came in was, are you seeing an increase in the need for foster parents? We know that the courts are closed right now, but with the high rates of death in our communities, are we seeing an increase in the need for foster parents?
You know, I don't know about the increase for need, because there's always need there, but what we do know that we're not receiving as many reports for child abuse, child neglect, and that's because the school system was so inextricably linked to our mandated reporters. So we don't know if that's because things are better, or simply because we don't have those mandated reporters out there working with the children. So again, my colleagues may have some more information that I don't, but we all foster kids.
Yeah, I think you're right, Dr. Crewe, that, we're seeing a downward decline actually in the number of children who are coming into the system. But I think it's just what Dr. Crewe alluded to, that we just don't have the reporters there. But all the data from any kind of disaster or crisis suggests that there is going to be an increase in the number of children who are being abused and neglected because of the social isolation. Parents need a break. All parents need a break. There's all this, blogging about parent overload. Well, certainly for birth parents who are very, very vulnerable themselves, you can imagine the overload on those parents, and child care centers aren't open. I mean, it's a lot going on for these families. So a lot of social workers are expecting this, you know, huge number of kids flooding into the system once the restrictions are lifted and kids are back in school. But I think, you know, what we need to do is be out there as community folks and be, you know, in touch, even if there is this physical distance, but to be in touch with those families that we know are vulnerable in the communities we know. And many community organizations are stepping up to the plate, handing out food, handing out diapers, handing out formula, the kinds of things that really can stress a family. Also having these community-wide call centers where families who are feeling the pressure can call in the way that you used to do, you know, with child abuse and child anonymous kind of centers and things like that. So creating those screening centers based on that kind of thing. So although we're not clear about, as Dr. Crewe said, whether the numbers of the need for foster parents is greater, we know that it's probably going to be greater very, very soon. But the other point I'll just raise is we know a lot of foster parents, as Dr. Crewe mentioned before, are elderly. And these folks are really vulnerable in this particular pandemic. So there are going to be a lot of foster homes that will not be able to be sustained because of the numbers of elderly foster parents. So we're going to need these kinds of things. The other thing that we're seeing is for older kids, you know, who are living in these facilities, a lot of them are running off, you know, because they're getting nervous. So there needs to be some kind of a safety net for those kids as well, better off in a home. So although the data are not necessarily saying there's this huge increase, clearly we know from past kinds of crises that there is going to be.
You know, and I think Dr. Jones-Harden, I would add to that, this is the time for our social work prevention skills.
Yeah.
To work on, because often we're talking intervention, but here's an opportunity. If we think there are things happening and we don't know about it, what can we start doing, working on prevention? And that prevention would start with the birth parents, with the other significant others, with the grandparents we're working with. We're calling them and doing reassurance check-ins with them. How's it going? You know, what are the things that are concerning you? So making sure that we don't neglect prevention in anticipation of intervention. So
Yes.
we have to really sort of do them simultaneously and strengthen our prevention work during this time. And it does go back to mental health and mental well-being, making sure that if I'm so frustrated that this youngster isn't doing their homework, I'm having to share one computer with 4 kids with different at different school levels. What we need to continue the group counseling, group intervention with parents who have the same issues, so they can realize that it's not you. It's not you. All of us were not, you know, cut out to be teachers. Some of us are great parents, but teaching algebra may not be our strong suit. So allow parents to talk with each other, the peer counseling networks. So that's a form of, my sense, in prevention that will help us not to have these huge anticipated loads that we're thinking about.
So Dr. Crewe and Dr. Jones-Harden, thank you so much for that. I think right now it's so important to remember prevention, because there's so much talk about intervention in our systems. And when you were talking about older parents, and the issue with ensuring that older foster parents may be leaving the system right now, we need to be aware of that. I think the point about virtual recruitment for foster parents will appeal to younger potential foster parents. And so that may be a positive opportunity that comes out of this very tough time. I would like to, I don't see new questions in the Q&A box. And so I'm going to ask a couple of the last few questions, kind of combining a few. But I've gotten a couple of questions about just the importance of fatherhood. If either of you want to speak to that before I pose our final question.
Well, we know when I think of parenting, I think of both parents. I don't separate them. So I think it's an opportunity, though, for us, to the extent that fathers are not in the lives of the children, this is an opportunity to invite them to become a part of the lives of their children. But that also requires preparation if there's been a separation, so that they can come together as a group. And how do I enter my child's life? You know, I'm concerned. So I see fathers as equally as important as mothers, and I don't separate them. I just think about parents. But I also know that they must be concerned. An absent father doesn't mean the father isn't concerned. There may be some other things going on. And I hear the news recently that children may also be impacted by the coronavirus. If I'm a parent, I'm concerned. I'm concerned now about their health and their well-being. So I think it's a good idea for us to reach out to fathers to make sure that they know that they're needed during this time, and all times, not just this time, all times. Fathers are, and particularly we know this for young girls, research has indicated the importance of fathers in the lives of their daughters.
Yeah, I agree with everything Dr. Crewe has said. I mean, one of the things that we have learned is fathering, although it might look a little different from mothering, is just as important for children's positive developmental outcomes as mothering. So really trying to reach out to fathers, whether they're custodial or not, is critical. And I certainly many times in my career have, had cases where if it weren't for the father and his family, the child would go into foster care. So one of the things that we've learned over the years is that we have to really get those fathers to name themselves on the birth certificates. That actually is a predictor for their involvement, and really try to reach out to them, because they and their families can prevent the child from going into the foster care system. So I absolutely agree with everything that's been said.
And this may be another opportunity for structural changes. If the father is unemployed at this moment, they've lost their job, and there's that ability to provide child support may be problematic. So we need to make sure that we don't bring further angst to the father because of late child support payments and all those kind of things. We need to be, helping them through this time and not neglecting their mental health and well-being.
So as a final question to you both, the world looks completely different, and the realities for Black children and families, especially those that are intersecting with child welfare systems, is also going to look completely different moving forward. And I'd like for each of you to speak to a challenge, but concluding with an opportunity that you see in our foster care system during this really unprecedented time.
Well, I'll start. First of all, I neglected to say to my colleague, I'm sorry for your loss. You said that you were sitting in front of a funeral home, and want you to know that we're with you.
Thank you.
So I'm so sorry for your loss. I think the challenge is to manage relationships from a distance, and how do we think about how do we keep the strength of the relationship and not lose ground because we're no longer able to physically visit individuals. There's something we can still do, those things such as letter writing. I'm writing older relatives that everyone isn't connected using technology. So we can go back to some of those old skill sets sending people notes of concern and caring. So I think we have to really think about the challenge of not being able to physically reach out and hug someone. We have to hug them in other ways. That is how we hug them in other ways, so that some of the underlying mental health issues don't escalate as well. The opportunities are to use this time to spend more time by telephone, by computer, as I said, by writing. The opportunity is for us to really kind of give some of the deep thinking to the best uses of technology. And some of these uses we will continue beyond the pandemic. We will find that this may work better with a youngster if I'm really, connecting with them differently. So I think we have to learn from some of the resourcefulness we put in place and continue it beyond the pandemic, rather than seeing this as a fill-in. It really is the way we're going to look for the foreseeable future.
I agree with everything Dr. Crewe has said. I think I'm going to use this opportunity to go back to something Dr. Crewe talked about earlier on when she was talking about the workforce, and really think about social workers. I want to remind all of us that social workers, in particular child welfare workers, are first responders. They don't, in the most cases, get to telework. I mean, in some jurisdictions, there might be a little bit of leeway about whether you have to do in-home visits, but let's face it, to do an investigation, to monitor child safety and well-being, that kind of thing requires face-to-face visits. So our social workers are out there really taking their lives in their own hands. And I want us to think about that as a challenge now. And I guess in terms of the opportunity, I would say let's right now give them the masks and the gloves, and in some cases the PPE equipment that they need to do their jobs. But more importantly, let's use this crisis as an opportunity to give them the credit that they deserve, instead of all the bad press that child welfare workers get. Give them the credit they deserve. Affirm what they do for us as a society day in and day out. So if you have a chance and you know one, say, I know your job is hard and I appreciate you, because what they do for us, basically ensuring the safety, permanency, and well-being of our most vulnerable children, not only helps those kids and those families, but helps us as a society to have kids who are going to come out and make a positive contribution to the progress. It might be a kid who's going to, make us not have to deal with the coronavirus or create a vaccine someday. So certainly we need to be, affirming them in every way we can.
Dr. Jones-Harden, Dr. Crewe, I want to thank you both. Dr. Jones-Harden, so sorry for your loss, and we do deeply appreciate you joining in. I wanted to read just one more comment, from just Miss Jan. Says, I want to mention my blessings to the social workers, because as a now adult foster child growing up in the system was tragic for me. I hear the love and concern for children, and I think it's amazing. Thank you. I think that's a wonderful point for us to include this session on. We did receive a question from Sandra. Sandra, if you can provide your email address. Sandra wanted to know more information about becoming a foster parent. We'd love to follow up with you and provide that information. Again, thank you so much. Our foster parents are a blessing, and our social workers are a blessing to so many families and children. So thank you so much, Dr. Edmonds, Crewe, and Dr. Brenda Jones-Harden, for your commitment to this work and your commitment to our families and children, and of course your partnership during National Black Child Development Week.
Thank you.
Thank you.